Encephalitis means brain inflammation. Brain inflammation can be secondary to infections, or it can be from an immune-mediated cause. Most common symptoms include alteration in the level of consciousness, confusion, headaches, seizures, and others. So early diagnosis and prompt treatment is critical for achieving better neurologic outcomes. The way that we diagnose patients with encephalitis is by listening carefully to their history, trying to get additional clues from exposures or other symptoms that may be concerning for an infection, for example, and also using imaging studies like MRI and spinal fluid testing that can be very helpful to determine the exact cause of the encephalitis. We do that by sending samples to our laboratories looking for specific findings in the spinal fluid that can make us further confirm or support a diagnosis of an infection, or when that's not the case, of an immune-mediated encephalitis. So it's important to narrow down and obtain or get to the definitive diagnosis because the treatments are very different. Given that encephalitis has a broad differential diagnosis, it's important to know the exact cause. So sometimes patients have encephalitis due to an underlying infection, which can be from a bacteria, a virus, or a fungal infection. But some patients do not have encephalitis from an underlying infection, but rather they have an encephalitis or from an immune-mediated reaction. Therefore, diagnosing the patient with the right cause of their encephalitis is important because the targeted treatments are different. Of course, if it's an infectious encephalitis, treatment directed to the specific pathogen that is causing the disease is important, whereas when it's related to an immune-mediated encephalitis, immunosuppressive medications that can stabilize and improve neurologic outcomes are the current treatments.